Good afternoon, everybody. Welcome back. It's the 8th week of our 8-week course, last week of the course, COVID-19 in Context. I'm Keith Mellinger, Dean of the College of Arts and Sciences. I'm happy to welcome you to our final week of the course. We have an exciting lineup this week, two really interesting topics that are touching all of our lives. Before we get to the topic for today, I wanted to quickly remind you of something that was in the email that I sent yesterday to all of you. And that is that we do have a special session planned for 1 week from today. The course ends on Wednesday, as we know, but next Monday, we've invited Miss Allison Balms-John to join us again. She's from the Rappahannock Area Health District. And, you know, there's a lot going on right now in the Commonwealth of Virginia, a lot of discussion about schools opening, about businesses opening, about policies and what the fall is going to look like. And we thought it would be a good time to bring her back and get her perspective on the Rappahannock area. So especially for those of you who are local, I think it'll be time well spent. And I invite you to invite others to join us as well. You saw a separate link in the email that I sent for that session. It's not the same link, so you need to share that other link with any friends that you'd like to invite to join us for that. That's next Monday at 4 o'clock. Today, though, we have two of our faculty from the Department of Psychological Science joining us, Dr. Miriam Liss and Dr. David Rettinger, who are going to talk to us today about stress, coping, and risk management. So let's turn it over now to Dr. David Rettinger to get us started on today's talk. Dr. Rettinger.
Hi, thank you, Dean Mellinger. Thank you to everyone out there for joining us for this almost last session. Let me start sharing my screen. Hopefully that'll work. And then we'll go ahead and get started. So today I'm joined by Dr. Miriam Liss and Eve Kagan, all associated with UMW, Department of Psychological Sciences. And today we're going to talk about some of the psychological aspects of COVID-19. So our agenda today is I'm going to talk a bit about the risk assessment aspect of COVID-19, and then Dr. Liss is going to talk about stress and coping, and then the three of us will be available to answer questions at the end. So double checking to make sure my microphone is on, and then we will dive in. So in the topic of psychology of risk assessment, what we're talking about here is that aspect of COVID-19, and in fact all of our lives, in which we take a look at the future and ask what is likely to happen in the future. And we do this all the time. Am I going to make the bus? Am I going to make that traffic light? And then we do it in two different ways. One is we do through a system that's actually quite similar to our perception. You know, we look at things, we see them, and then we make quick automatic responses to them. Sometimes they're a bit more in-depth and cognitive when we make a decision, and often they're really quick and automatic. When they're quick and automatic, they are that way because we use emotional responses. Now, when we talk about emotions here, we're not necessarily talking about literally just your feelings. We're also talking about all of those intuitive aspects of your emotional processes as well. So let's dive right in to a really important aspect of psychological science, which is prospect theory. Prospect theory is a really important part of decision theory, and it has two different parts. One part where we apply our own values to our decisions. In other words, do I like vanilla better than chocolate? And if I like vanilla better than chocolate, then given a choice, I'd probably choose it. But prospect theory also handles the questions about uncertain situations. So not all choices are chocolate versus vanilla. Often they're choices about things where we don't know what's going to happen in the future. And when that happens, we're likely to weight possible outcomes based on what Tversky and Kahneman, the authors of this theory, referred to as the decision weight of the different possibilities. And so what they say is that we take our stated or our belief about what's likely to happen, and then we translate that to a weight which is essentially how we act on that thing. We sometimes refer to it as our subjective perception of the actual likelihood. And we use this to evaluate probabilities of events in the future. So in other words, we take what we see and we know about the world, in this case about coronavirus, and we apply that to our decisions in the future. So I want to take a moment and talk about this graph that I've put up on the screen. And as you can see on the graph, there is, on the horizontal axis, there's what they call the stated probability, which goes between 0 and 1. And that refers to what you see in the world, or what we would give you in a decision problem about the probability of some event happening, where 0 is there's no chance of it happening, and 1 is 100% chance, or it's certainly going to happen. So that's on the horizontal axis. And on the vertical axis, you have what we're calling the decision weight. And what the decision weight refers to is our psychological experience of that chance. And the point of even making this graph is for Tversky and Kahneman, and now me and other decision scientists, to say, we don't always experience probabilities in the way that they actually are in the world. Just like we see an optical illusion sometimes, you sometimes have these psychological illusions of risk. What I want to do for a moment is zoom in on the bottom left-hand corner of that graph, this part, because I want to show you two key points. First is that we overestimate the chances of unlikely events. And second, we underestimate the chances of most other events. So if you take a look at the far left-hand corner of the graph, what you see is the dark line, that's our actual probability curve, is higher than the dotted line. And the dotted line refers to what the correct answer would be. It's the diagonal, it's 0, 0 on that line. However, as you move right on the axis, you see that it crosses relatively low, and then the dark line is lower than the dotted line. What this means in practical terms is that for most events, we tend to underestimate the chances of it actually happening. And so we're pleasantly surprised when most good events happen, and we're slightly unpleasantly surprised when not so good events happen. But what's really interesting here is what happens for really low probability events, all the way at the bottom of the scale. What you can see, of course, is that the dark line is higher than the dotted line, which means we overestimate these unlikely events. What I want to do is zoom in on that bottom bit and really look at it carefully. So what you can see here is that the dark line doesn't actually quite get all the way to 0 in prospect theory. And this is based on lots of different psychological experiments where you see that the curve doesn't touch 0. And this is because there are two different possible all unknown responses to very unlikely events. So the graph doesn't really capture that. So what happens with very unlikely events is, one is what you see on the graph continues, and people overestimate these unlikely events. And this happens especially when these unlikely events are very vivid and easy to imagine. So like, for example, catching coronavirus. It's easy to imagine getting quite sick from this disease, especially in those very bad cases. And so we sometimes overestimate the possibility that that'll happen. And in turn from there, we act as if it is a more serious threat than it is. However, the other possibility is that we round down. And this happens a lot with very low probability events. When something is very, very unlikely, we often act as if the probability of it is 0, that it can't actually happen at all. Think about this with respect to lottery tickets. Ask yourself, have you ever bought a lottery ticket? For most of us, the answer is yes, we have bought them, but not very often. And most people don't buy them either at all or much at all. And why is that? Well, that happens because we round down to 0. We describe the outcome of buying a lottery ticket as, you're not going to win, and therefore I'm not going to buy one. We call that the certainty effect. And what the certainty effect does is it basically takes very low probability events or very high probability events and turns them into always or never situations. And when you get these always or never situations, it makes it a lot easier cognitively to respond to an event, but it does oversimplify things. Now, I'm sure you know folks in your life who are reacting quite strongly to the risk of coronavirus. Right? There are folks who are staying inside most of the time. They are ordering from Instacart when they can and doing other things because they act as if they feel that the risk of coronavirus, especially given the consequences for certain high-risk groups, is not worth taking. And so those folks are acting perhaps strongly, if not too strongly, to the low likelihood event because they're overestimating the chances of it happening. Of course, as the days go on and more cases occur, it may be the case that what was yesterday's overestimate is today's estimate. But leaving that bit aside, it is the case that we psychologically overestimate events, especially when they're really risky. You can imagine this is a very healthy response in very complex environments. However, some folks you may have seen around aren't wearing masks. They're not taking precautions. Why is that? Well, to some extent, they're doing it because they're pretty certain they're not going to get it. Getting coronavirus is still a very low probability event, and they're rounding down to 0. And so as a result, you're seeing this bifurcation or these very different responses based on how people are assessing the risk of coronavirus. It's worth noting there's lots of other reasons why people are or are not wearing masks, having to do with things like politics, social identity, and other important factors. But this is one that really matters a lot. If people don't judge the probability of this event as being existent, then they're not going to do anything about it. And this leads us to talking a little bit about the emotional responses to risky events as well. So we do these risk-benefit analyses like the ones I've been describing in prospect theory, but and we do them mathematically, automatically in our heads, but we also inform, our decisions are also informed by our sense of risk. So the best way to think about it is, if you don't perceive a threat, there's no cost of preventing that threat that's worth it. You can imagine this from the historical vaccination arguments, right? Lots of folks out there are saying things like, I'm not going to get a vaccine for my child or for myself because there is some risk that that vaccine can cause harm. And that's of course true. There are risks to vaccines. However, the folks who are saying that are often folks who have never experienced any of the negative consequences of the things that are being presented. In other words, they don't feel threatened by things like polio or measles, mumps, and rubella. And if you don't feel like there's any threat there, when you think about vaccinations, your emotional response is, oh, this vaccination is risky. Your emotional response is not, oh, the disease it's preventing is risky. Because if you've never seen it, it's really hard to have an emotional response to it. And so as we think about vaccinations in case of coronavirus and also basic preventative measures, it's really hard to get worked up about an event that you can't really imagine happening. And so we have a lot of folks out there who are not having emotional reactions to coronavirus, or their emotional reactions are being shaped by things other than the virus itself, such as political or other considerations. And their response is very neutral towards the virus. They're not doing much about it because they're not having this emotional kick that's getting them to toward acting on the risk. So what do we do when people are so divided on this risk assessment? What should you do based on our understanding of the psychology of risk assessment? Well, I'm going to argue that we need to try to make rational decisions based on a comparison model. It's really hard to know because there's so much that we don't know about the actual state of affairs, right? We don't know what the chance of getting very sick if you contract coronavirus is, right? The variation in that has been tremendous depending on context so far. We don't know what the chance of dying if you do contract the illness. There's this case for fatality rate has been different by orders of magnitude, by 10 times, depending on the person and the situation. And what's the chance of spreading the disease in various situations? You can read the internet, and just today I read there's no chance of children spreading coronavirus, and children are very likely spreading coronavirus in exactly the same way that adults are. So it's somewhere in between those two things, I would imagine. But the fact of the matter is we don't really know what a lot of these risks are. We have some reasonable scientific estimates though. And so when in doubt, use the most reasonable scientific estimate you can find, of course. And what you're going to try to do whenever you can is you want to benchmark any decisions you make based on other decisions that you've made in the past, especially the ones that you've made without thinking much about it. So what I'm getting at here is, as a country and as an individual, we often respond to risks in our lives based on well-learned, understood principles, right? And so some risks are worth ignoring, right? You could get hit by lightning tonight. Doesn't look very cloudy out, but it's a possibility. But you're probably not worrying about it much. That is a risk that you can probably agree that you're not going to worry about. However, on the other hand, you might get into a car accident later today. What do you do about that? Well, you probably wear a seatbelt. You probably drive a car with airbags, if at all possible. We acknowledge that some risks can be managed by our decisions, and we try to make our decisions in order to do that. So as I was saying, it's really hard to do that with coronavirus because we don't know everything we need to know. But we do know some things about it, including what the death rates look like. So these are some old data from June 23rd. They were collected by the New Atlantis, which is maybe not the most outstanding of all news sources, but you can see the data sources originally are the CDC and other government agencies. So we'll go with it. What I want you to notice is the big red curve on the left side of the graph, which you can see over here. And it's remarkable how many people are dying from coronavirus on a weekly basis at the peak. This is June 15th. Our graph is probably coming back up. It's in here somewhere now. And so you can see that coronavirus is not in fact the flu, right? It is actually on a week-by-week risk basis the most dangerous thing that happened in the U.S. At the peak of the infection, and it probably will be again soon if it isn't. So what sort of reaction is appropriate to coronavirus? Well, based on the data, the answer would be the sort of reaction as a country we give to the most dangerous things, way more so than car crashes, way more so than flus, up there with cancer and heart disease. I don't have to tell you, as a country, we spend hundreds of millions of dollars trying to prevent cancer and heart disease each year. And so it doesn't seem unreasonable that we should make our decisions as a country based on that level of risk. As an individual, what you're going to try to do is compare COVID to risks, other more acceptable risks, like car accidents. Well, as you saw on the graph, it's way, way more dangerous than that. And so then what you want to do is make informed relative judgments. Well, in the case of car accidents, we do a lot on a daily basis to protect ourselves. We wear seatbelts, helmets, we have traffic laws that affect our choices all the time, drunk driving laws that criminally penalize doing things in a dangerous way. It doesn't seem unreasonable as individuals and as a society that we should choose to react to coronavirus in the same way. So with that, I'll turn it over to Dr. Liss, who can talk to you a little bit about what happens psychologically once you've made that decision to take coronavirus seriously.
Thank you, Dr. Rettinger. Let me share my screen. So hopefully this will go smoothly. Okay, so you should be seeing my screen. So someone pop on if you're not seeing it just fine, but I'm gonna just proceed. So thank you, Dr. Rettinger. And in my portion of this talk, we're going to talk about some of the symptoms of stress and anxiety commonly experienced in response to COVID and give some tips on how to cope with it. And then we're going to focus more specifically on the issue of loneliness, which has been an unfortunate side effect of the need to engage in social distance. So here we are. Now we're going to start with the coping with anxiety and depression. As Dr. Rettinger noted, concern and anxiety about COVID is an appropriate reaction to making a realistic risk assessment. However, one of the biggest challenges of COVID-19, according to an article recently published in the Lancet, is to raise just enough anxiety and concern to encourage people to engage in appropriate practices to reduce the spread of the illness. So we're talking about wearing masks, washing hands, social distancing, without exacerbating anxiety and other mental health issues. And this is definitely a concern because anxiety and mental health issues are definitely on the rise. Recently, psychologists have identified something that they are calling COVID stress syndrome, which they are becoming quite concerned about. One researcher suggested that the psychological footprint of COVID might actually be greater than the medical footprint. And researchers have conceptualized this COVID stress syndrome that consists of 5 different factors. So one component of it is a fear of dangerousness of COVID. So this includes worrying about getting the virus, worry about contamination, and fear about dying from the virus. And that you would think would be the biggest issue in response to COVID, but there's a lot of other factors that people are stressed about. The second is the fear of socioeconomic consequences. So this is both fear about one's own personal job loss, but also fears about the supply chain, like all those fears that we had that toilet paper would run out and that kind of thing. The third factor is xenophobia. So COVID was originally presented to us as this Chinese virus, and a lot of people have responded to that with fears of other people, fears of foreigners. The fourth component are people who are experiencing symptoms of traumatic stress. So we're talking about things that happen to other people that experience significant trauma. So insomnia, nightmares, pounding heart. And so some people are responding to COVID with these real symptoms of traumatic stress. And the fifth has to do with compulsive checking and reassurance seeking. So I'm sure you've seen some of these behaviors. These are people who are constantly checking the internet or, for COVID case rates, or maybe constantly checking with their doctor or with other people, asking if they think they're going to be okay. And researchers have shown that this is really becoming quite common. About 38% of people are experiencing some distress and 16% were highly distressed. So how are we going to cope with this very common distress associated with COVID and learn to manage the stress and anxiety? Well, Before I give some more specific psychological ideas, I'm going to give you some advice that you probably already know, but it's really important to realize that a great deal of our mental health is determined by how well we take care of our bodies and regulate our eating and our sleeping schedules. So I'm going to give you some basic advice. Keep a regular schedule. I know a lot of people's schedules have gone really off. I know my kids, has happened to us and our kids, where people are staying up super late and sleeping late, but we do feel best when we keep a regular, consistent schedule and go to bed at a reasonable hour and wake up at approximately the same time every day. It's important to try to eat well. We've had a lot of time to make a lot of junk food and eat a lot of junk food, but other people maybe have used this time to explore more healthy eating options. And if we put healthy food in our body, it's going to really positively affect our mental health. And the third is to get outside and get moving. The benefits of exercise on mental health cannot be overstated. There's been hundreds of studies showing how exercise can positively benefit our mental health. There's also growing evidence that being outdoors specifically is good for our mental health. And we do know that COVID spread is less likely to happen when we're outdoors. So exercise that we can get outdoors is really important. In Virginia, we're blessed with so many beautiful parks and outdoor spaces, and I know it is so hot now, so nobody wants to go outdoors. But if you can get outside early in the morning or maybe late in the evening, and I know this heat wave eventually is going to break, but physical activity, especially outdoors, is really going to help our mental health. But this is all probably advice you have heard before and you know. So I'm going to talk about some more specific psychological techniques, because the stress of COVID is real. And we have to learn, we're going to have to learn how to tolerate a certain level of anxiety and stress and negative emotions. And another way to talk about this is to say that we need to learn how to tolerate distress. So being able to tolerate distress is central to a number of psychological therapies, including one called acceptance and commitment therapy and another one called dialectical behavioral therapy. And these are relatively recently developed forms of therapies that incorporate skills of mindfulness and acceptance and promote learning to tolerate distress instead of only focusing on alleviating distress. And people are having a lot of distress. So before we discuss how to tolerate distress, we should talk about what happens when we can't. When we're feeling anxious and depressed, we often feel shame and anxiety about having those feelings. We feel like there's something wrong with us, or maybe we're broken in some way, and or that we're just not okay. So people do anything to get away from those feelings. They might turn to drugs and alcohol. They might spend countless hours watching television, or they just might bury themselves in their social media feeds. Or people might deny or distort reality. This is what happens when people round the risk of COVID to zero, as Dr. Rettinger was talking about. Their inability to tolerate distress might make them kind of distort the reality of the situation. So how can you learn to tolerate distress? Well, one technique is a technique psychologists have identified called radical acceptance. It's where you fully embrace the moment and the situation and the feelings you're having. So instead of saying, it's not fair that COVID happened, it's ruined my job, it's ruined my life, you can move forward, you can move toward realizing, COVID is here and we need to accept that reality. Similarly, if you're experiencing stress or anxiety, you can have acceptance towards those feelings of stress and anxiety instead of castigating yourself and saying, I shouldn't be stressed or anxious right now. What's wrong with me? Why can't I just feel better? You can accept the reality that this is a stressful and anxious time for yourself. So as you can see on the slide, there's a few specific techniques of radical acceptance. The first is to notice and observe your fighting reality. So just notice, that you're saying to yourself, it shouldn't be this way, this isn't fair, I don't like this reality. And then remind yourself that the unpleasant reality is just as it is and can't be changed. So you remind yourself, COVID happened, it's here. There's nothing we can do about it. And remind yourself there's causes for the reality. This is how things happened. Viruses happened. There were, mutations in this virus and it hit humans and here we are. Another technique to manage negative emotions is to realize that thoughts are just thoughts. Just because we think something doesn't mean it's true. You can think, I'm going to get this disease and die, or I'm going to lose my job, lose my home, starve to death in the street. But that's just your mind making up stories. Instead of always believing your thoughts, it's important to be able to identify them as thoughts and to get a little distance from them. You can notice them and say, I'm having a really stressful thought right now. Just that little separation between yourself and your thoughts can keep you from running into an anxiety spiral. You can imagine your thoughts as clouds floating by. The distressing thoughts are temporary unless you jump on that cloud and go for a ride. Other techniques to tolerate distress is to try to find some joy. Before the COVID pandemic, the psychological field began to focus more on researching things that make us happy and improve our well-being. And this is the field of positive psychology, and there have been hundreds and hundreds of studies that have been written on specific techniques that would increase happiness. So some of these techniques include practicing gratitude for what you have, getting involved or engaged in any activity that's fun or enjoyable. So some people are taking this time to read some good books, or going outside for a walk or a bike in the park when the weather is more tolerable, drawing a picture, watching a movie, or just putting on some music and having a big dance party in your living room. Another technique to manage negative emotions is to work on being aware of the moment and focus on your senses. Some people have used this COVID time to start a practice of mindfulness meditation, and there are hundreds of studies demonstrating the psychological benefits of mindfulness. Another technique, and this is a technique used by therapists who teach distress tolerance to people who really are having a hard time, is to focus on their senses. So if people are feeling very stressed or anxious in the moment, they can get a nice smelling lotion and just focus on that nice smell, or even eat a lemon or a lime and focus on that tart smell. Find something soft to touch or pet. Animals work great in this capacity. Take a walk and pay attention to how the trees look in the leaves. Take a bath. Something that focuses on your senses can take you out of getting kind of pulled down into that anxiety spiral and focusing on your thoughts so much. Okay, so those are some techniques to help cope with some of the stress of COVID. Now we're gonna move to the topic of loneliness, because in addition to the distress associated with the fear and uncertainty about COVID, there's been a lot of distress associated with loneliness. Now, loneliness is not something that just started with COVID-19. In fact, it's been considered a rising epidemic in America. So data from before COVID suggested that 37% of Americans felt feeling chronically lonely. And one study found that 1 in 4 Americans had spoken with no one about something important to them in the past 6 months. And loneliness is really problematic. It's been linked to a variety of different disorders. You can see some of them on this slide. Some of them are psychological, like depression, alcohol abuse, sleep problems, and some of them are physical, like Alzheimer's disease, autoimmune disease, cardiovascular disease, even cancer. Research has also linked loneliness to poor outcomes when one is sick. For example, one study found that lonely HIV patients or AIDS patients were more likely to die. And another study found that cancer patients with loneliness had weakened immune systems and they had immune suppression. The physical health effects of loneliness appear to be partly due to an inflammatory response. It seems to work when we are lonely, it actually increases our tendency towards inflammation. And loneliness can actually feel like physical pain. Research has even found that the pain associated with loneliness can actually be reduced by taking pain medication like Tylenol. So why is loneliness so painful for us? Well, researchers suggest that it might actually be an adaptive evolutionary response. It is so painful to feel lonely that it motivates us to seek social connections, and social connections have helped us survive. However, I do have some good news, because being alone is not the same thing as being lonely. So people who are quarantining alone are not necessarily going to have all of these negative psychological effects of loneliness if they feel as though they are connecting to other people and they have an opportunity to feel cared about. However, people are quite concerned about the loneliness associated with the COVID pandemic. And one paper published in The Lancet did say that an increase in loneliness might be one of the largest mental health risks of the COVID pandemic. And this is particularly concerned for the people who are living alone. And older adults in America are particularly likely to be living alone. And as you know, older adults are also most likely to suffer negative consequences from COVID. So it's a tough situation. This is a kind of complicated graph with lots of numbers, but if you look at the line that says living alone, percentage of adults living alone. So these are percentage of people ages 60 and older in each household type. And I want to point your attention to this 27%. That's the percentage of adults in the U.S. who are living alone. And if you see, the U.S. is among the highest of people of having people live alone. So older adults really are at risk for kind of increased loneliness, because even if they do have people that are checking in on them and showing that they care, they are more likely to be living alone. And if you're living alone, you are also not gaining the benefit of affectionate touch, right? Because you're not getting those hugs. And affectionate touch actually have been shown to be really excellent for both our physical and psychological health. And it seems to benefit us through two pathways. So there's the emotional pathway, which when you get a hug, you feel loved, and that feeling of love decreases stress. But there's also a physical pathway. The touch increases things like oxytocin and endogenous opioids. All of these are hormones and chemicals that make us feel good, increase psychological and physical well-being. In fact, affectionate touch has health benefits. And one study about the cold virus, which is similar, in the same family as the coronavirus, showed that exposure to affectionate touch actually made it less likely to get sick if you're exposed to a cold virus. So there's a lot of benefits to affectionate touch. So what can we do to decrease loneliness in this time of social isolation and quarantining? So what are we going to do? Well, reach out to other people, right? Whether or not you're alone or sheltering with other people, reach out, talk on the phone, talk to someone, and don't just talk, but talk about something meaningful and important. At least, I've seen it recommend at least 15 minutes a day. We all have a little less to do than usual. So maybe we can use that as an opportunity to reach out to people we haven't seen in a long time. I know a lot of people are taking this COVID time as a time to maybe reach out to old friends and have Zoom calls, Zoom happy hours, and that's all really good for us. If you are living with other people and have people in your household, take advantage of affectionate touch. Hug each other consensually, give a back rub, snuggle with the kids. If you have somebody in your life to hug, take advantage of it. Know that that has great both psychological and physical benefits. Practice kindness, both to yourself and others. So bring a meal to someone living alone, call someone you know is living alone, volunteer in any way you feel comfortable. Research has shown that kindness has benefits both for the person you're being kind to, but also for yourself. When we're kind to others, we feel better ourselves. And also practice kindness to yourself. Really share your emotions. So this is similar to reaching out in terms of something meaningful, right? Be open with others about how you're feeling. Remember, loneliness is less about physically being alone and more about feeling like we're not connected to others. So the more we emotionally reach out to other people and are honest about how we're doing, the more we'll feel connected to other people. And similarly, really listen to other people. Sometimes we get into conversations, but we're also simultaneously checking our Instagram feeds or, not 100% there, right? So when somebody is talking to us, really put all our other devices down and listen to them. Be present in the social connection. And finally, use telehealth. So if your loneliness and negative emotions are really getting out of hand and interfering with your functioning, please seek psychological counseling. There's a lot available using telehealth. And there's also telehealth programs designed to specifically counter loneliness among the older population. I'm just going to give you one example of this to kind of end on a somewhat happy note. There's a intervention called the Circle of Friends intervention that has been used with older adults. And this was an intervention that was in place before COVID, and they would bring older people together and have them do like creative arts and activities and group exercises and health-themed discussions and therapeutic writing and sharing and reflecting. And on the left, you can see the list of things they did before COVID. And on the right, you can see how they adapted these to online activities. So they were sharing art online or doing in-home exercises online. You can still share writing or diaries or blogging. And I know some of my older relatives have a hard time figuring out how to use Zoom. And I know that can be a challenge, but the extent to which we can try to use the internet and online interventions like this to help older adults. Research on this particular intervention really did show that it decreased loneliness, social isolation, and healthcare costs among older adults and increased feelings of well-being. So we're almost running out of time and we're almost to the Q&A, but I do want to make a few final thoughts. First, depression, anxiety, loneliness are completely normal in the context of COVID-19. If you're experiencing them, there's nothing wrong with you. You're not broken. This is a shared global experience. There's an idea called that to experience a sense of common humanity. And this is something that all human beings are dealing with on this planet. So we are not alone in the stress and anxiety that we're feeling. However, if you are having symptoms that are interfering with your ability to function, please reach out to get professional help. Also remember, this is temporary. I know it seems like it's been lasting forever, but it's not. The future is uncertain, but we will get through this. And finally, to bring us back to the earlier conversation on risk assessment, it's possible to be responsible without being anxious. And to do that, you have to try to work to appropriately evaluate your risk. Okay, so thank you for listening. And I think it is time for the Q&A.
Well, thank you, Dr. Liss and Dr. Redinger. What a wonderful presentation, incredibly timely as we're thinking about all the stresses that we're dealing with. And you've done a wonderful job of really outlining so much of what it is that we're facing, as well as some ways that we can better frame this and to contextualize exactly what we're experiencing. As Dr. Liss just mentioned, we're getting ready to move into the Q&A, and it's my pleasure to introduce the third panelist for the Q&A, and it's Miss Eve Kagan, who's a licensed professional counselor here in Fredericksburg. And I want to offer her the first question as we're thinking about, as the presenters outlined, so many of the stressors related to quarantine, lockdown, and just general COVID stress syndrome. Are there any predictions that you would make or anything that you would anticipate about long-term effects that we might experience ourselves or might expect to see in others?
Thanks. It's good to be here with everyone. I can't predict the future, nor would I try. At the same time, as Dr. Liss was saying, we are experiencing a collective trauma. And it's something that we, at least those of us who, have been born, let's say, within the last 100 years, have never experienced before. So it's unprecedented to a certain degree. And what we know is that trauma has an impact. It has an impact on the brain. It has an impact on the body. In terms of the brain, it impacts not only the functionality of the brain, but the actual structure of the brain. So to say that we would come out of this unscathed, I think is probably near impossible. At the same time, what can happen when we experience trauma is post-traumatic growth. So we all know about post-traumatic stress, and we've talked about it today as well, right? So you may be experiencing heightened anxiety. Many people are experiencing a lot of grief and loss, which isn't able to be processed in the same way, right? So if you lose someone and can't go to the funeral and mourn with other people in person, that has a huge impact. In the same way, when we're not able to be around each other, we're starved of touch right now, as Dr. Liss was talking about. That's a really essential aspect of how we have survived as a species. So this is really challenging, right? And so in the face of this trauma, what can happen once we get through this tunnel, which we will, because we are a species that has survived and we will continue to do so. And I know for me personally, I like to remind myself of that we are survivors as a species. When we get through that other side, we may look back and look forward with greater appreciation for our lives, for the connections that we have, for the people, for the sunset, for the little things that we often lose sight of when we're steeped in the uncertainty and the grief and the loss. And I invite everyone to take those moments now to start to build that resilience within yourself and that growth. So on those days where you feel so anxious, and I saw people writing about what's the difference between having normal anxiety. Well, right now, everybody's normal anxiety, I would say, is probably a little higher than all of our normal, right? Because we're faced with this uncertainty. And so understanding that the baseline normal anxiety for everyone is a little heightened now. When we're looking at disordered anxiety, we're looking at an impairment in functioning. So when you're at that point where you cannot function at your optimal level, where the anxiety is so overwhelming and uncontrollable, that's where we're looking at disordered anxiety. But in those moments, if we're not looking at disordered anxiety, we're just looking at heightened anxiety, right? I invite you to take a breath, because breath is so essential if we're going to start to regulate our nervous system and deal with distress tolerance. And to just say one thing, one small thing that you have gratitude for in that moment. It can be the teeniest, tiniest thing to start to balance the scales and to start to build your resilience, so that when we get through this, you're able to look around and to embrace where you're at in each moment.
All right. Thank you very much for that. That's good advice and something I think a lot of us needed to hear. I'd like to turn to Dr. Liss maybe for the next question. How do you know when anxiety or stress is part of just your personality, or is actually a disorder of some sort? With the current COVID crisis, is it harder to distinguish between the two?
Yeah, I think Eve partially addressed that, right? We're all higher up here than typical, right? And so the baseline of what would be normal anxiety and what would be abnormal, that's always a fuzzy line, right? So when we teach abnormal psychology, we spend a lot of time talking about how it's not always clear. It's not like there's a 100% demarcation between normal and abnormal for all of these things. And the way to tell is if it's interfering, if it's causing significant distress, so much that you are just saying, I cannot tolerate this, please help me, this is not okay. And that's completely subjective. Only you know if you're experiencing that. Or if it's causing significant dysfunction. So if you're unable to do the things that you need to do to function through the day, take care of your kids, get to class, get through your work day. So if it's interfering with your ability to function, then it's abnormal, or if it's harming others. So stress and anxiety tend to harm ourselves and not harm other people, but other things might harm other people. But the kind of demarcation for that difference between normal and abnormal has to do with often distress, and that's completely subjective. I'm not in other people's brains, so I can't tell if the stress you're experiencing is so bad that it's abnormal. You have to tell that, right? And then dysfunction. So, but it's a slippery slope. I was talking to my father-in-law, who's a therapist, and he says all of his patients with obsessive compulsive disorder are feeling great. I think he's not, he was maybe exaggerating, but they're feeling like kind of their hand washing activities now doesn't feel abnormal anymore. So they're feeling more validated, right? So the kind of what is considered normal has kind of shifted, right?
Yeah, that's really interesting as you think of the way that we're processing and coping and working through this really traumatic experience. It really has changed our perspective in a number of ways. This next question, I think, really builds on that. I want to turn to Dr. Redinger because I think it gets to a bit of that sense of risk assessment and coping. When this is all over, which is hopefully sooner rather than later, and who knows what that's really going to look like, but do you anticipate that maybe we'll be better prepared to handle stress in some normal everyday life, or are we going to retain kind of that fragility, the brittleness that we feel now?
Yes, which is to say that different people are going to respond differently. I mean, I'm not a therapist, and Dr. Liss or Ms. Kagan might want to address the particulars of the stress, but I think in terms of our decision making, I think there's no doubt that the frames through which we make decisions are going to change going forward. I think there's going to be perhaps some unhealthy risk-taking that happens once we're able to get back out there in the world, because some of those risks are going to look fairly benign compared to the ones that we've been facing on a daily basis in our homes. And that's actually something I'd be interested to look out for, is to see whether some folks are going to respond by actually bringing more risk into their lives. I do think some folks are going to have long-term sort of echoing responses. PTSD has been mentioned a couple of times, and I would be shocked if we didn't see large amounts of what we call in the field subclinical PTSD, by which we mean there are people just getting over trauma with showing some symptoms that maybe aren't meeting the standards that Dr. Liss was just describing, but are still experiencing some distress more so than they might normally. Does that seem reasonable to everyone?
It does. I'm curious, though, if maybe what you're recognizing is the possibility of people engaging more dangerous or more risky behavior, if that's already happening now, if that's part of the reaction to kind of lockdown scenario, and then people saying, all right, we're through it, I'm going to go and do whatever I want at this stage.
Yeah, I see party boats and other videos like that. And it's hard to judge whether that's the result of people feeling like they're in the clear, or people feeling like they're stir crazy, or going back to what I suggested originally. These are people who've rounded their risk down to zero. And they never really bought into the idea that they were at risk in the first place. And so their responses, the being cooped up was the stimulus that they're responding to, not the threat of getting sick from coronavirus.
Right. Thank you. Thank you very much for that. I want to turn to a particularly controversial topic that I feel like I see this in the news every single time I turn it on now, and that is the wearing of masks. And there's, of course, a political aspect to this. But I think the spirit of the question I want to ask that's been posed is not political at all. It's a personal decision-making question. There's the issue of personal rights, which we hear a lot, but there's also the issue of the greater good. And I wonder if maybe we could start with Dr. Liss. Maybe you could comment a little bit maybe on how the thinking works of an individual and how they come to those conclusions when one outweighs the other, the personal rights versus the greater good.
Yeah, I mean, I think there's a lot of aspects that are rolled in. I think a big piece of it does have to do with Dr. Rettinger was talking about in terms of the assessment of risk, right? And I think it also has to do with whose risk are people thinking about? Are they thinking about their own risk of getting it, or are they thinking more about other people? And there was one study that I saw that showed that a certain personality trait, it's called the dark triad, which is a combination of narcissism, so it's thinking about the self, Machiavellianism, which is a sense of needing to get ahead or, not minding who they're stepping over, and psychopathy, which is kind of a lack of empathy, that those three personality traits were correlated with refusal to wear masks in situations where maybe masks were being recommended. So that was one interesting study that showed. I do think that there are individual differences in terms of empathy, and in terms of, how much you're putting your own needs over other people's needs or thinking about other people. So, I'd love to see some more research about some of those personality traits, associated with COVID. The amount of published studies on personality and these kinds of mask wearing behaviors are pretty small because this is all very new, but I did see that one study. So I thought that was interesting and possibly related to that question.
I think we want to stay away from politics, and we should do that, but it's worth noting that this mask controversy doesn't exist outside of the United States and a handful of other countries, right? And so if you look through, say, Europe, which no one would say is uniform politically, right? Europe has 18, 20 countries with widely ranging political spectra. There's no controversy about wearing masks anywhere from Moldova to Northern Ireland, right? So something's different here in the US that's leading people to draw these conclusions. I would suspect, and I have no evidence whatsoever to back this up, so let's be crystal clear, that the personality trait that's more predictive of mask wearing in Europe is not the dark triad, but rather something more like conscientiousness, right? And that's more about doing what you know you're supposed to do and whether you get around to doing it or not, right? Oversimplifying a little bit. So I'm not going to call it politics, I'll call it cultural context, but I'll say that cultural context is playing a huge role in the way people are making decisions with regard to their health. Yeah, you're seeing,
Really?
someone commented that you're seeing this in other scientific contexts within the US versus other places, like, for example, climate change or other
Yeah.
or the way we relate to science is different in this country at this point than it is elsewhere in the world. Not everywhere else, but elsewhere generally.
I think that's really interesting because it's not just the collectivist versus individualist country or cultural aspects that you might typically see, but perhaps the view on science and the way people respond. And really odd to think that it's become politicized. So thanks for that. That's really interesting. I want to take the discussion away from the third rail of politics and talk a little bit about what we're experiencing in terms of what this means in this experience and such a traumatic shared experience, particularly for younger citizens, our kids, our young people that are working through developmental stages that are hindered because of lockdown. We've heard a number of experts talk about, and pediatricians and even epidemiologists saying sometimes the risk of hindering that developmental process is something that would outweigh the risk of exposing them in certain instances, such as going to school, and trying to evaluate that is really difficult. How do you anticipate, and let me turn this to Ms. Kagan and Dr. List perhaps, and thinking about it as counselors, how do you anticipate that this experience might affect very young generations, their developmental growth, and will it be difficult for them to be able to interact with peers once we get through this?
You want to go first? All right, well, I'm unmuted, but I'm going to throw back to what Ms. Kagan said about post-traumatic growth. I mean, I think every child is going to react differently, and some children are going to be more hampered by others. I'm quite concerned about family environments that might be unsafe or, abusive. I think that there's definitely children that have been in those environments, but I think there will be the opportunity for pure, I'm only hopeful, maybe I'm an optimist, that when they go back to school, I have a 14 and a 12-year-old, one who's about to start high school or not start high school, and one who's going into 7th grade, who really did not necessarily look forward to school in 6th grade, but now cannot wait to go back. And I do think that, maybe there'll be this pure joy once they come back together. But I'd like to throw it to Eve. We have a comment that we want to hear from Eve more.
Thanks. Yeah, I predict a bit of both. I don't like to predict again. At the same time, I think kids are very porous in the way that they are so insightful and are picking up on the energetic level that we're all at. So even if we take the abusive household out of the situation, we're all operating at high anxiety, which means the kids that are at home with the parents that are worried about, let's say, employment, or worried about health, or have lost some grandparents and didn't get to say goodbye or go to a funeral, let alone if we're going to start to invite in, which we know is a huge factor, the abusive households, there will absolutely be an impact on the development and on the brains of these young people, especially since so much of school for a lot of kids is a relief from that suffering and pain and trauma. So to now not have that and to not have peers, and absolutely somebody's commenting, yeah, it's also college kids as well. Absolutely. To not be able to interact in these, what we would have called predictable ways, is going to have an impact. And young people, and I'll include college age all the way through itty bitty, are incredibly resilient and resourceful. And that is what I have seen with the younger generations kind of across the board, not to mention very tech savvy, really little even. They are finding ways to connect, and some of those ways are really ingenious. So as Dr. List said, I'm hopeful that resourcefulness and resilience will triumph. And I also recognize that there's going to be a lot of unresolved trauma in young people. And the difficult thing is that trauma and grief, especially in really younger kids, does not show up the same way as in adults. So my concern is that in the wake of this, there'll be a lot unprocessed for the younger generation who shows up looking like everything's fine, when really their way of processing trauma and grief is so different. I'm worried stuff is going to go under the radar and get undetected. And so hopefully, I know you all have had panelists who are educators. There's going to be a lot of education about that as well, so that educators can detect some signs in kids when they do start to come back to school, and hold the space for that collective healing that's going to have to happen too, right? Even if you think about, like, is it okay to hug my friend? You know, barring consent, which I know and I'm very happy about has been something that's taught at younger generations, that wasn't a question, right? A year ago, as long as your friend said, yeah, it's okay that you can hug me. For a 5-year-old to enter into the classroom again and not know how to manage that distance, there's going to be an impact there in terms of how we understand what safety means and what security means, and how to navigate that in new ways.
Thank you for that. We only have time for maybe one more question here, and I'd like to sort of throw it out to all three of you. It's sort of two parts here. One is the psychology of coping. Obviously, people can't go to the gym, for instance, like they could before. So people must be finding new ways to cope. And I'd like to hear you comment a little bit on the psychology of that, of finding new ways to cope. But also, what are the long-term consequences? Are we learning something? Are our brains developing from this? Are we learning from this experience? And are we going to come out maybe in a better place after this is over with better skills in coping? So maybe start with Dr. Liss. I see you're unmuted. What are your thoughts?
So I think everyone is going to handle it differently. And as Ms. Kagan noted earlier, the idea of resiliency is so important. And some of us are going to be able to really find new ways to cope. So, you know, discovering outdoor ways to exercise, discovering hikes. You know, we can't go to gyms, so we're going to discover new hikes, new things to do, new ways to exercise at home, new things to cook, new ways to garden, new games to play, new songs to listen to, new movies to watch, books to read. I mean, there's opportunities for growth, and finding, you know, the extent to which we find these new ways of coping gives us the message that, yes, we are resilient, we can do this, we can get through this. And I think that does have the potential to make us stronger. To know, wow, I went through however many months of pretty much social isolation, and yes, it was tough, but look, I read these books and I saw these movies and I discovered this and that new hike, and I, started meditating or gardening. I think that there's a lot of opportunities to move this in a positive direction, but we have to, I think, not get caught in those anxiety spirals and not, tie ourselves up into knots or feel shameful when we're feeling stressed or anxious. So I think, there's potential for growth and for new coping, but also a lot of risks for depression, stress, and anxiety.
Sure. Thank you. Dr. Rettinger?
Yeah, I think the official plant of the American Psychological Association might be the hedge. So I'm going to agree with Dr. Liss that you're going to see a wide range of coping mechanisms, some of which are going to be more effective than others. I think the thing that's really interesting to me is watching people try to navigate the risk assessments that come with living your life. In some ways, it was less stressful from a decision standpoint to be locked down, right? You're locked down, don't leave the house, period, paragraph. That's relatively easy from a decision standpoint. Nowadays, everything is a fraught decision. Do I pick up my groceries? Do I go get them? Do I have them delivered? Can we go to the beach? Should we go for the hike? Do we have to wear a mask in the parking lot? Decision fatigue is a real thing, and self-control is a depletable resource, which means that the more decisions that you have to make that go against what your natural response is, the harder it is to make those decisions in a way that meets your own goals. So I think that over time, what we're going to see is, to the extent that we're going to be able to, we need to be able to figure out ways for each and every one of us to figure out what risks we're comfortable with, and to build new routines that don't require us to make decisions every few seconds, because it's going to be really hard to do that effectively. So like Dr. Liz said, go for a walk instead of going to the gym. If you can get out and on your walk before you have to think about whether it's okay, not only that makes your walk a stress reliever as opposed to a stress causer.
Thank you. Ms. Kagan, final thoughts?
My final thought is my favorite word, which is and. I love this word because it embraces the ambiguity. And I want to invite all of you to recognize you're suffering right now. We're all suffering right now. We don't have to make comparisons about it. We can all just recognize that the anxiety, the uncertainty, the trauma, the grief, the loss, that's suffering. And we have the capacity to grow. We have the capacity to heal. We have the capacity to build our resilience. So I love this metaphor. It comes from the Buddhist tradition. I've spent some time in India and Nepal. I've seen it in the flesh. From the filthiest muck, the lotus grows. It can only grow from those conditions. So knowing that those things are both true, we can be suffering and we can see beauty and we can grow. The two can be a big and go hand in hand.
Well, what a perfect set of comments to conclude with. Thank you for that. Eve Kagan, Miriam Liss, David Redinger. What a wonderful session with so much for us to think about and for us to be able to internalize and to be able to act upon. Thank you for that. We really appreciate it. Want to remind everybody that we have another session this week and talk about timely. We knew it was going to be timely, but never knew it was going to be quite this timely. The pandemic's impact on K through 12 education this Wednesday at 4 o'clock, as our school boards are having emergency meetings and parents are trying to figure out what to do next. This is going to be an incredibly important session for all of us, and I think we're all going to learn a lot. And what a panel. We have Dr. Pete Kelly, Dean of UMW's College of Education, Ms. Princess Moss from the National Education Association, and Dr. Melanie K. Wyatt from Spotsylvania County Schools. So you're not going to want to miss that one. Wednesday at 4 o'clock. We'll see you back here. Thanks for everything. Again, to the panelists. My name is Anand Rao. Thanks for joining us. We'll see you on Wednesday.